It's time to dig in about types of pleural fluid, as well as signs and symptoms of pleural effusions. We will begin with types of pleural fluid. There are usually two types. First one is transudate, and second one is exudate. Let's see their features so we can easily differentiate them. First of all, transudative effusions are bilateral, which means present in both lungs, while exudative effusions are unilateral, which means in any one lung. If we talk about protein content, then transudates have protein content less than 30 gram per deciliter. And in terms of pleural fluid to serum protein ratio, value is less than or equal to 0.5. In case of exudates, protein content is greater than 30 grams per deciliter, and pleural fluid to serum ratio is more than 0.5. LDH or lactate dehydrogenase levels are less than 200 units in transudates. And in terms of pleural fluid to serum LDH ratio, value is less than or equal to 0.6. On the other hand, LDH levels are greater than 200 units in exudates. Here, pleural fluid to serum LDH ratio is more than 0.6. Nature of transudative fluid is serous and clear, while exudative fluid is serous in case of tuberculosis, rheumatoid arthritis, cloudy in case of infection, and blood comes in exudates in case of cancer, pulmonary embolism, and TB. Possible causes of transudative effusions are cardiac failure, nephrotic syndrome, which is a condition resulting in protein loss in urine due to problematic kidneys, hepatic cirrhosis, that is compromised liver function, hypoalbuminemia, or low albumin proteins in blood due to malnutrition or malabsorption. Reason behind exudative effusions can be bacterial pneumonia, some sort of inflammation, or carcinoma, which is primarily bronchial or secondary. Signs and symptoms depend on size of effusions. If effusion is small, it might go unrecognized, but if it is large enough, it will be noticed by specific signs and symptoms. Let's recall difference between sign and symptom. Sign is basically objective evidence and identifiable by another person or your physician, while symptom is subjective evidence experienced by a person himself and cannot be identified by anyone else. Typical signs and symptoms are chest pain, as effusions restrict lungs expansion and cause pain. Dry or non-productive cough is another sign. Patient might be suffering from fever, difficulty in breathing while laying down, and shortness of breath are some clues for pleural effusions. Diagnosis and treatment will be discussed in next parts, so keep watching sqadia.com.